Dr. Andrea Liner, thank you so much for being with me at IVF Companion.
Thank you so much for having me. It's an honor.
So I was searching, and I guess, sometimes the algorithm just knows what you're looking for after a while. So you popped up in my feed one day as, licensed clinical psychologist specializing in reproductive health, been through your own IVF journey. And I felt like this is just something people need to hear about when they're trying to build their team. We've gone over all kinds of resources, but I feel like someone that speaks the lingo and has the shared experience is going to be just vastly different from anyone else that you can really talk to. So, but I want to let you tell your story. So, given that you work at the intersection of infertility, pregnancy, loss, postpartum, all that, what helped shape your journey as to where you're at now?
Yeah. Well, I have been a licensed clinical psychologist for a decade now, which feels crazy to say because I'm still 18 years old. But timeline aside, I've been doing this a long time and I love doing therapy. I pretty much was following my age cohort with their issues. So I was very young when I was in grad school. I started working in university counseling centers with the undergrad and graduate students. And then I started working with adults, kind of a failure to launch kind of situation, or when people are first moving to new cities, starting their careers, and transitioned into some relationship work with breakups and things, just kind of the things that my age cohort were experiencing. While I was doing that, I found myself in a fertility journey that I was not expecting to have. After my husband and I were married for a year, we started trying to conceive. It wasn't happening, wasn't going well, started the whole process, and it ended up being 4 years long with multiple doctors, procedures, 2 rounds of IUI, 3 rounds of IVF to get our son. And throughout that time, I was noticing that I didn't know of a lot of people who talked about this professionally. And it does exist as a field, but it wasn't talked about when I was in my training. I had to kind of find it on my own. And I found myself getting a little bit frustrated in my own therapy experience with how much time I was spending explaining things. I'd come in upset because my AFC was low. Well, my therapist doesn't know what that means. So I have to explain, okay, well, it's your antral follicle count, and it's that initial scan they do to see how many, But this was all news to her. And she was so, open to hearing about it and wanted to hear about it in order to support where I was emotionally. But I just remember thinking, when I'm on the other side of this, I want to be the therapist for someone who doesn't have to explain this, who knows all the lingo, who knows what it feels like, who knows why one disappointing phone call feels like the end of the world, and not have to intellectualize it or explain it for someone else's consumption. So I decided to seek out some additional training, get involved with some organizations I had discovered along the way, and I switched my specialty kind of during my maternity leave and came back, and now my practice is fairly exclusively, mostly women, but also sometimes partners going through various parts of this process, and realizing kind of through my work with other people as well as my own experience that it doesn't go away when you become pregnant. That's not the end of the road by any means. It's just a change in the path, but there's still kind of a specific experience that goes along with that. So supporting people kind of throughout the trying to conceive, the navigating the treatments, the pregnancy after infertility and loss, and then parenting after a hard road can look a little different. And just wanting to be a support that I wish I had had at the time.
Oh, wow. I mean, when you mentioned the support when someone becomes pregnant, although I fantasized about you get the pregnancy test and everything is just so beautiful afterward, you can leave your support group and it's great. I have a sense that there's a 100% need for whatever you might experience. I want to say survivor's guilt, kind of you get a win, but also extreme anxiety. I've heard that from a lot of people. So wondering if you could just elaborate a little bit about what you're seeing, and in yourself too, in women's experience once, you get what you always wanted.
Yeah. So it's wild how universal this seems to be in the women I speak with. Obviously, the goal for a very long time is getting pregnant. And sometimes we need to set a shorter goal for ourselves, so the getting pregnant is what we're focused on. But people who are going through the fertility process likely know a lot more about how things work than people who become pregnant spontaneously or accidentally. And so these women, they have experienced losses. Maybe they had pregnancies that made it to 6, 8, 12 beyond weeks prior and had struggled since. And now they have this precious pregnancy, especially one that maybe costs tens of thousands of dollars to get to and months of prep work and shots and everything. And suddenly the stakes feel so high because yes, you're pregnant, but it's delicate. And we all know too much to know that just because you get a positive pregnancy test does not mean you're taking home a baby. And unfortunately, that is a reality that a lot of us have come to firsthand. So in the regular pregnancy space, the typical pregnancy space, as I refer to it, there are a lot of women who have, lucky for them, and no need to apologize for it, but the privilege of just getting excited that they didn't have to go through the process to get there in the first place. They haven't had losses yet, and they're just excited, as they should be. But the women in my community and in my experience, it didn't feel that way. So there's a lack of resonance with some of the typical pregnancy spaces where people are just celebrating and using language like, I got a positive test today. I'm having a baby in September. That can be very triggering for women who know that it doesn't always work that way. And people can be surprised, why aren't you more excited? Why aren't you coming up with a list of names? Why aren't you having a baby shower? And people just don't get it when they haven't been through it. So having a pregnancy space where that is talked about openly, where we can hold the excitement, yes, but fear and anxiety and talk about what that looks like and have conversations about when do I want to tell people? Because last time I told people at this point, I had to untell them. Or how do I have a conversation with my mother-in-law who we didn't share we were doing IVF with because of cultural beliefs or whatnot. And this feels so delicate and all she wants to do is start buying things. And I'm only 10 weeks along and that feels intrusive. And how do I talk to her about that? So creating space for those conversations and those feelings, I think is so needed because I can talk about this experience too, but, I was in a regular pregnancy space when I was pregnant and so much of it didn't resonate and I felt other and I was worried about things they weren't worried about and they were flippant about things that almost offended me. Like, how could you risk eating sushi in your pregnancy if you could get sick? These fears that would come up. So I think the typical pregnancy space, it feels like that's our goal to enter, and then it doesn't feel like it's for us. So there needs to be special spaces for people experiencing a different kind of pregnancy.
I vibe with that. I mean, I know the attempt to be perfect for every embryo transfer and, what you eat, what temperature you're exposing yourself to. And then I don't see myself letting that go when I cross the threshold.
Yeah. The anxiety doesn't go away. It just kind of changes shape.
Yeah. Well, taking us back to the IVF process, I believe I saw that you have experienced missed health conditions or maybe missed like lab results or things, which is very painful. Not everyone's looking for it. But if you're talking to other people and you start doing the deep dive research and then you look at your reports, I feel like unless your information is being scrutinized by a doctor at the clinic, which is not always the case. Sometimes you're just cycled through. Mm-hmm. That got me upset just reading it because I resonate with it. Would you be open to sharing anything that was missed for you?
Yeah, absolutely. So I knew that I might have some troubles with some underlying health conditions because I had a diagnosis of lupus from when I was 19 and it had been in remission for a long time. But it's in my system and it's inflammatory and it's autoimmune. And so there are always some question marks there. And I thought that was going to be the bulk of it. But as we started the process, it turns out I have PMOS now. And we found insulin resistance that was probably affecting my egg quality that my first clinic didn't do anything about until after 2 egg retrievals with poor egg quality outcomes. So that was a big one. And then probably the biggest surprise was that I had slightly elevated calcium in my blood work for years. I was just outside of the threshold for the typical ranges that they give. And I had never had a doctor worried about it. It would come back, with the alert on my report, but they'd say, oh, that's nothing. Well, when I was working with a functional doctor, finally, after being like, what is going on with my egg quality at 32 years old? And he saw the high calcium. Finally, he was like, well, we should test your parathyroid. And I had never even heard of a parathyroid. I was like, what do you mean my thyroid? I get that checked. I have hypothyroidism. I'm on thyroid meds. No, your parathyroid is different. It regulates your calcium and phosphorus mechanisms. And so we tested the PTH hormone and it was through the roof, like really bad. So then the next step is to get an ultrasound where they saw a mass on my parathyroid. It was benign. You can get these like tiny little benign things, but it messes with your levels. And when I did my own research on it, well, guess what high calcium or hypocalcemia causes? Miscarriage. Why was this never addressed? It took someone like being willing to dig a little bit deeper. And once we fixed that, I think it made a big difference.
What kind of supports did you have encircling you at the time, if any?
So many, luckily. I think being in this field, I know how important support is. So, very supportive family, very supportive partner. I love my therapist who has not experienced IVF, and I have educated a lot, but she knows a lot more now. So she was a great support. The functional doctor I found had been a huge support. And then switching clinics, I found more supportive as well. The medical team there.
I want to hear how, from your perspective, I think you could say it a lot better than me. I have like trouble explaining like why this can sometimes hurt or feel insensitive. But when well-meaning people will, I don't know, put their meaning on something like, oh, it's up to the universe, it's in God's hands, or the just relax. Mm-hmm. Why does this feel off?
Well, what that tends to be is it's their inability to sit with discomfort. They say those things because the idea that this may not work out or that you will be sitting in uncertainty feels, it's not nice and neat and it doesn't have a little bow tied on it. So I'm going to give you this platitude to kind of tie it up nicely for myself. It's really indicative of their distress tolerance. So that's kind of what I think about when people say things like that, like, oh, you don't do bad news. You don't do discomfort. Like, okay, this is what you need to feel okay in this interaction. But it's frustrating. And depending on the day and my mood and the relationship I have with the person, sometimes I give them some pushback. Sometimes they say, I know you mean well with that, but that doesn't feel helpful.
Yeah. I mean, it could be someone that you really need. And in general is like wonderful. And you don't always feel like wanting to blow it up and being like, listen, that was not right. Cause it's like, who knows who truly like, it's a skill, it's a learned like wisdom and skill of like how to be with people.
And I think I'm always picking my battles a little bit on intention versus impact. I think there are people who make comments and their intentions are not good. I think there are people who are trying to, give you a little dig, twist the knife a little bit. And then there are people who really do not intend for that. And I try to treat them accordingly. Sometimes I can let things go. Sometimes I use it as an opportunity to educate a little bit. But it really depends. And I'm working on a way to talk about this more publicly, but I also am a believer that sometimes there's just no right way to say things. You can talk to ChatGPT and craft the most beautiful message for a friend going through infertility. And depending on their mood and how raw they're feeling and what's going on that day for them, something about it isn't going to sit right. Like sometimes we just need to understand that there just has to be a lot of grace in this time period because nothing's going to feel right or good at times.
Mm-hmm. And full disclosure, with a family member long ago, I tried but have you tried this, and this to them? Now I know.
Yep.
And I think that applies to anyone going through a serious health condition. Like, that's just not the need.
Yeah. And I've had that happen too, where, someone would make an insensitive comment to me years ago and by accident and, well-meaning, of course, but then years later, they're having their own experience with some kind of reproductive grief or trauma. And it's tempting to be like, do you remember when you said, but I have not.
Grace. We give each other grace. Okay. You did mention sometimes partners are brought into therapy. And if they are, like, what's typically the use case there? Like, what are you doing when a partner's coming in?
So sometimes I see partners as my client.
Oh, individually. Okay.
But I don't typically do sessions with both members of the couple. I used to back before COVID when I had a physical office space. I would do some couples therapy, but now it's typically I work one-on-one. However, if it really seems like in the couple, like there's a relational struggle there, I always recommend couples therapy. And there are couples therapists who specialize in infertility as well. Or, we just we will talk about suggestions of conversations to have. But I rarely bring a member in, partially because the way I was trained is that I'm so aligned with the client that I've been working with that when the partner comes in, there could be a bit of triangulation going on, and I don't want anyone to ever feel ganged up on. But I do love offering referrals and things for partners who are in need. And I think it's really beautiful when partners seek out support on their own, when they take that initiative. Like, hey, I'm having to be really strong for my wife going through this, but I'm also struggling. And I think sometimes the men in particular need a reminder that exists for them and that they have a right to seek that out for themselves.
Yeah. And I think that the processing for men seems to be different. This is only from my experience and talking to a friend, but I think it has something to do with our nature and the fact that so much is happening within our body. Do you have any more thoughts on that?
Yeah. It's funny. My husband and I would get into some fights during the process, and it's not because he's not a good supportive partner, but there's only so much he could do. He can't take the burden from me entirely. And there would be times where I would feel really alone in the process, or like I needed more from him. And we had this really good, honest conversation at one point where it was like, but what does that look like? And I was kind of at a loss. I mean, really what I wanted him to do was do it for me. Like, if there was a day I was feeling too weak for it, you take the shots, you go get the wand stuck up you go get poked and prodded, and you take the phone call about the results in the middle of your busy workday. Like, you do that. And it can't.
Yeah, I'm just realizing right now that the reason that I've been asked my husband to be so present with my medications, like he wants to anyway, but I would be like, let's get up 8 a.m. Let's go. I don't actually need someone to give me a shot in my belly, but I needed that witnessing. Like, look at what we're doing. Look at what I'm doing.
Yes. Absolutely. And there were times where, like, okay, theoretically, yeah, especially with the belly injections, like, I'm so good and fast at those. Like, do I need him there? No, but I want to feel like this is an us thing. And actually, this is language I did use with him at some time. I said, throughout this process, a lot of times this feels like a me project, but it should feel like an us project. And he heard that, but again, it's like, okay, but how? And so the advice I typically give to people is have your partner be as involved as they can be on anything logistic. If you have to be on hold with the insurance company about something, that's a great task for them to take on. Doing medication inventory, helping you keep things organized, sharing the mental load of it. Medication calendar was up on the fridge. Like, I wanted him to be like, hey, have you remembered to take your this yet today? I wanted to share that load with someone, knowing when appointments are, all that good stuff. But it doesn't have to be insane. I don't know if you've come across the side of TikTok and Instagram where there are these husbands like doing the most for their wives, or they're setting up these like carts and caboodles with all the medication organized and a basket of snacks and the ice packs and it's all very aesthetic and it's beautiful. And okay, that would be phenomenal, but that is not the standard that we're holding our partners to. It doesn't have to look like that.
Right. Then what happens when they can't go to a clinic appointment with you? I mean, that's like a high pedestal to drop down from. I have full understanding that, sometimes I need to phone in a friend or maybe record the conversation, share it with him later from the clinic, stuff like that.
Yeah.
But I do love me like a sparkly medication organizer just because I like ritual and I like, putting something fun around it or good music during injections.
Yes.
Let's talk unhinged and illogical thinking. I think that you would be the best person to speak to. Like, I would feel safest in a therapeutic environment as opposed to revealing, oh my God, I think my husband's just going to leave me because of this, or things that I deep down know aren't true. But if I say them to air them out to a friend or my husband, I'm going to get the fixing tendency, like the reassurance. And I feel like the need is really different for that.
Mm-hmm.
So I think you've gone through some things and you help women through this. Can you talk to me about like what processing that might look like?
Yeah. It's funny. And maybe the reason that you thought to even ask this, I had a post go fairly viral recently about, I made a post of actual unhinged thoughts that I had myself. And I'm a trained psychologist. I think I have a pretty good grasp on reality and logic and the way our brains work. And I posted some of these thoughts that I'd had, and the comment section, it was just like a group therapy session of people being like, me too, me too, me too. I didn't know anyone else thought this way. And, speaking of group therapy, like one of the perks of that is just knowing you're not alone. Like that can be one of the most healing therapeutic elements of this process, is knowing you're not crazy. You're not the only person who's had these thoughts. But I would have thoughts like, and they felt so unique at the time, but I'm hearing that they're pretty universal. Maybe I'm just not meant to be a mother. This is the universe telling me I'm not cut out for this. Maybe this is some karmic retribution from a past life. Maybe I did something to deserve my infertility. Maybe I picked the wrong partner. Our DNA isn't compatible with each other. I chose wrong, and now I'm being punished for it. Maybe this is some weird protective mechanism of the universe. Like I would die in childbirth if I did get pregnant. So that's why I'm not. Just I'm a bad person. All these things. I'm less of a woman. I can't do the one thing that my body's supposed to do biologically. And I mean, these all felt like really outlandish to me at the time. Well, turns out pretty universal. And just knowing that you're not alone in them, and they don't have to be true. We can have a thought without it being reality. We can say, oh, that's an icky thought. No, thank you. Let's think about something different. We don't have to internalize every thought that we have, but it's easier to do that when we can recognize how outlandish that they are and how harmless they can be if we let them. But when we're dealing with that in silence, that's when they spiral and they get bigger and they turn into a vortex in your own head. So I think having a safe space to get them out is very, very helpful.
What do you feel is missing in the IVF experience overall from start to finish?
Well, I'm a bit biased here, but I think it's the emotional support. I think unless you have a great therapist already or a naturally very supportive group of people in your life, and not everyone does, depending, I know a lot of women doing IVF, they're new in the city that they're living in, they don't have anyone around them. It just becomes very medicalized. And I think the medical support, it continues to improve. I think the health support around fertility is continuing to improve, but having emotional support feels like an afterthought. And I think a big part of this is it's not directly linked to success outcomes. And there actually have been some recent studies about success outcomes with people who have more emotional support versus less. And it is looking like it does make a difference. But I think when people are thinking about how to spend their precious dollars in a very expensive process and their time when having to deal with a million appointments all over the place, emotional support falls to the bottom of the priority list sometimes. And yet, when people finally come to me, they have broken down. They have lost themselves completely. They feel their friendships and relationships unraveling. They really feel like they are just at their limit. And my hope is that people can start getting support before it gets to that point so that it doesn't get to that point. And also just throughout the process, like we were talking about earlier, it doesn't end with the positive test. It doesn't end when you graduate from your fertility clinic. And that's a point for a lot of women that things get really dicey because you're leaving this kind of comfortable nest of your fertility clinic you've been in for a while, and you're going out to this typical pregnancy world where you only get one scan every few weeks and no one really understands the trauma it took you to get there. So I think there needs to be continued emotional support. And then even into postpartum, it doesn't become easier to have a newborn, or you're not less privy to postpartum depression or anxiety or psychosis just because it was a hard-fought pregnancy. You can still have all the struggles at the end too. And then there's guilt and what did I do? But I asked for this. I have no right to complain. I shouldn't need help because I worked at this for so many years. All of those thoughts. So throughout the process, I think we need more emotional support. We need more people telling you that that's normal, telling you here's a way to cope with that. Here's a way to have that conversation, and just sitting with you in what you're feeling. the doctors will deliver you horrible news. They'll basically tell you, sorry, this didn't work, and there's very little chance that you're ever going to be a biological parent. Okay, bye. Got to go to my next patient. And not exactly like that. I'm being a little bit dramatic for effect here, but kind of not far off sometimes. I had a session with a client yesterday who told me that in a 35-minute appointment, she was basically informed for the first time that she has endometriosis, that it's unlikely her results are going to yield different results, in 35 minutes. And then it was back to the workday grind. There's not enough holding happening in this process.
It's starting therapy early, that takes being informed and being brave to face the possibility that it might not work the first round. So I have a couple friends I know that might be going into IVF, and I don't know if I want to tell them there's groups and there's therapy. I think it's kind of nice to go into it naive at first. Yeah. But then again, the other side of that is preparedness, just general courage and to prepare for what this might be. But it does put you kind of in the mix of other women's experiences that are super long haul, and that's hard.
It's true. And that's why individual therapy can feel safer for a lot of women because, and that's some feedback I've gotten on the pregnancy community that I run, where women are like, this is a great idea and it's needed, but hearing about other women's struggles or the things that might go wrong for them is too triggering for me. So that's where individual therapy can be helpful. And I also want to offer that therapy isn't just for the disappointments or the failures along the way. It's for navigating the process in the first place. It's a lot to keep track of. It brings a lot of emotion up. There's grieving of the path you thought you'd take to get here. Hopefully for everyone trying, IVF works their first cycle. But that doesn't mean that you might not want some support along the way because, hey, I never thought I'd be here. I'm grieving what this didn't look like. I'm grieving the losses I've had up until now. I'm struggling to relate to my friends and family who don't know much about this process or who didn't have to use this process, even before failure or bad news comes into the picture. There's a whole lot that we can work on in therapy.
Now I want to back up and add that I hope my friends do have success the first time. I hope that is the situation. And I talk to plenty of people who do. And yeah, as someone that's been doing it for a while, there's pain and processing for me to hear that because I celebrate them and it hurts at the same time. But oh yeah, people go through and they don't have underlying conditions to find out about, and it doesn't become a journey or or I've seen you post as an odyssey. That said, I do wonder what to call this. When I make posts, I put journey, and then I feel weird about it. It kind of reminds me of when I worked in corporate and everyone's like, let's go on a journey together through this PowerPoint about our next organizational change. Mm-hmm. So, and I'm not going off Lord of the Rings, leaving the Shire. It feels like more, an odyssey with several ups and downs. I say a path sometimes to make up for the language. I've used the word warrior, but then I want to be softer about it all. I don't want to be with the shield and the sword.
The language is hard. And I've found as my Instagram presence grows, I get a lot more opinions from people.
Yeah.
And as things, reach wider audiences. And people have very strong feelings about the language, which I think makes sense. I think it can also be an illustration of how when you're going through it, nothing's going to sound right and you're wanting to pick fights about things. I think that's absolutely part of it. But yeah, journey can feel so flowery. And we're making it a positive, but being a warrior implies a fight and a victory or a defeat. We don't like that. I say the word process a lot. I feel like that's pretty neutral, but that can make it sound really clinical. So I use a lot of words interchangeably, and I just really cross my fingers that I'm not hurting someone's feelings.
Mm-hmm. And often it becomes such a new identity. Unfortunately, I feel like I've already been through so many identities, person going into IVF who's about to get pregnant, and then person with unexplained infertility, person with endometriosis. I just keep adding on these layers. And when anyone asks me how I'm doing, it's so layered with, I don't know what else to say, but I want to live a whole life. And with the team I've built, I'm hearing that all around. Like, you got to find your people. You got to live your whole life. You got to like understand what you're grateful for now. But nonetheless, it's like centered. It's like primary goal. And I don't feel like I can get away from that.
This is the number one surprise that I find people have when they embark on this process, journey, whatever we want to call it, how all-consuming it is. It is not, and that's what the people who aren't in it don't understand about, our energy levels, our desire to socialize, our moods, all of it. It's not just, oh, it didn't work for you last month, but this month, let's go on a girls' trip. Like it doesn't just go away like that. I haven't been sleeping well, and oh no, that's not good for my egg quality. And should I take melatonin? Okay, well now there's a study about melatonin for this. Okay, well maybe not. Well, am I eating well enough? Oh, I do want to go to that birthday dinner this week, but it's at a restaurant that I don't know, there aren't many healthy choices. Like, can I go? Ooh, should I have a drink? Like, is that ruining everything? But will people ask me too many questions if I don't have a drink? Like, it's I could keep going. But
I feel so at home in your stream of consciousness right now.
It's everywhere. It's all the time. It's, I don't think I can, I had girls trying to make a girls trip to go see Backstreet Boys in Vegas. I'm like, I don't know if or when I'm going to be pregnant. Can't plan for that. Oh, I'd love to buy the new cute trendy clothes this fall. Oh, but I've put on 40 pounds for my fertility treatments. And if I'm just going to get pregnant, it doesn't make sense to but what if I don't? All the time, everywhere, everything.
And you're probably seeing people all around the world. You're like, people can have a session with you virtually.
Mostly. So I'm PsyPact, which means it's a compact for doctoral level psychologists to work across state lines. And so far, I think we are up to 43 states and territories have joined. But unfortunately, some of the larger players have held out. So California, New York, Massachusetts, not in PsyPact. And obviously other countries are not in PsyPact. My workaround for that is I do offer some coaching services that look similar to therapy, but there are some key differences. So if people really want to work with me because they want me specifically, but they are not in one of those 43 states, we have a slightly different way to work together. But I do see people kind of from all over.
Mm-hmm. So you're probably seeing the universal common experiences.
Mm-hmm.
Well, to close, I want to ask you something I ask everyone, which is, what is one thing that you would say to someone going through the IVF process right now?
Gosh, only one thing. So many things I want to say to people. I think the biggest advice I would have for people is, resources depending, try to look at each stage of this process as data collection. It's not a yes or no. It's not a success or failure. It's what did we learn at this step of the process about my body, about my health, about how I respond to these medications, to what worked well, what didn't. And if you can kind of come at it with some curiosity and this idea that we're collecting information so that we can make adjustments as necessary, I think it's a little easier to maintain some hope throughout, as opposed to looking at we got good news or bad news.
A lot of wisdom there. Well, thank you. I'll be sure to link all your information under the video.
Thank you so much for having me, and good luck to anyone listening to this.
Hi, Alison here, and thank you for watching this video. If you enjoyed it, please give it a like, and better yet, subscribe so you can stay apprised of all upcoming updates and interviews. There's also a link in the description if you're interested in a packing list for IVF abroad. This was based on my 3 trips abroad in Mexico, where I really figured out what was best to have with me for going through such an intense process. Also, we have a meetup group, and there is a link in the description as well for that. Would love to have you there, where we can really figure out how we want to support each other as we go through any stage of this process. Thanks.